I am now going to introduce the owners of this fabulous boutique in Denville, My CBD Organics. So the owners are Shaquana and Giovanni Paul. And they are our gracious hosts for the evening. And anytime you have any CBD needs. So why don't you tell everybody just a little bit about yourselves and why, and they're another fabulous husband-wife team, why you actually wanted to own a CBD store.
Well, that's a loaded question.
Great,
Sorry,
thank you.
everyone can hear me now? Yeah, that's a loaded question. But to put it in short, is similar to Robert and Holly's. We also, within our family, my mother, my son, we basically used it. Oh, yes, my wife has back surgery, herniated disc, pinched nerve. And we've tried so many things, and similar to Robert, my wife is anti-pharmaceutical. The doctor, when she went through her surgery, the doctor used to send mail. I didn't even knew this couldn't even happen, but he used to send maybe like a
bag load,
a box
load of.
Within 2 hours of her calling saying she needed something to our door with 6 to 10 different opioids. And he said this would shut your brain off for X amount of hours. This will do this, and the long-term effect, we were just like, wow. Now we can see why people get addicted to these type of pills. So my wife was just an advocate on natural, and basically from then on, we've experienced topicals, we've experienced the plant from oils to ingestibles, and we've seen the results and how powerful it is without any side effects. So with that, we just continue our search and basically just continued using, and this basically evolved out of that. Similar to Robert and Holly, we wanted to educate the masses and provide a solution as well. So it became a goal for us, for ourselves individually. Then it evolved to a business. Then it became into a passion that now that we're consider ourselves advocates of the industry.
Awesome.
Anything you want to add?
Not really. You pretty much said everything. So as he said, like I personally was in a lot of pain, and I wanted to find another way of healing myself. So for me, I started with an ointment. Then from there, I did a tincture, and then now my go-to are teas and gummies. So for me, it's important to educate for myself, but also to educate everyone else in the community. So that's why we built the store here. Not only because we wanted to sell products to people, we wanted to educate everyone. We want everyone to know, if you're going to buy this product, then you need to know what you're taking and how you should take it. So that's important for us, that we have things like this, that we can open to the community. We can go to other resources and connect with Holly and Robert, so we can basically bring it to the masses. So again, thank you everyone for coming. Thank you Holly and Robert for everything. Thank you for all the presenters. So I hope everyone enjoy yourself, and please enjoy the store and all the great food and the massages. So thank you.
It really is. They are committed to offering an opportunity for an alternative, natural, healing therapeutic. And that's what all these products are in this store. And that's what CBD is, but it is not all created equal. And that is something that is very important, that you shouldn't just be buying it anywhere. You should understand packaging, ingredient for ingredient, seed to self. You need to be educated. And you should ask questions about, questions are good. But they are committed to not only being in Denville, they're on a mission to really impact health, and in New Jersey and beyond. So thank you. both so much for hosting this event because education is so vital. Now we have 3 amazing speakers this evening, and we're going to invite them all up. And they're going to stick around at the end if you want to talk to them personally. We've asked them to do such. The first person I'm going to call up is Ralph Murray, who is a cannabis nurse. So, Ralph, come on down. So, yeah, sure. So, Ralph, why don't you just tell everybody why, as a nurse, that you feel it's so important to incorporate cannabis into your offerings when you're with people?
Well, I think the main reason that I really care about CBD as a therapy is because of the, both the risks of addiction and some of the stronger things, and just the general side effects. And by and large, CBD has different levels of effectiveness for different people, but it's generally not harmful. There is one caveat, I didn't know where exactly I would introduce it, is that it can interfere with the metabolism of some other drugs. So there's a pathway in the liver, the CP450, which is just a word, but almost all drugs are metabolized through the liver. So it doesn't actually cause harm, but it can slow down the metabolism of certain drugs. That means that they can build up in your system. So that's something from the medical standpoint that I just want people to be aware of. And there's one general thing to look for if things warn about not taking with grapefruit or grapefruit juice. That's a good signal that it could interact. But that's also really depends on, talk to your healthcare professional if you're concerned about that. It may build up, but it also may not. Like if you take your medications in the morning and you're taking CBD for sleep at night, there's probably not going to be an interaction. But just be aware of that it could have an effect.
Well, I was going to say earlier, I think it's really important to say, CBD right now is not an FDA approved product, okay? We really address it as a supplement, just like your vitamins, okay? Or nutritional supplements. So we cannot claim to prevent, treat, cure, or diagnose anything. And we always recommend you speak to your doctor, not necessarily with the CBD products as much as sometimes the full plant. So talking about that, we all have something called the endocannabinoid system. So why don't you tell everybody a little bit about what that is?
So the endocannabinoid system is a system like your nervous system, your lymphatic system. It is only now starting to be taught in medical schools and things like that, but it is a real system that's in all mammals. That's why CBD can help cats and dogs as well. And it is a signaling system that's involved with pain perception, memory, mood, a number of different processes, and it's like a regulatory system. So that's why for anxiety, pain, a lot of times sleeplessness comes from, in a way, anxiety, your mind is racing. That's why it can have an effect on those things. So it is a real, actual system in the body that was only recently really discovered. Your body creates its own cannabinoids, and they're called endocannabinoids. And really interestingly, the main one is called anandamide, and ananda is Sanskrit for bliss. So it's actually named the bliss molecule. Your body produces that. And CBD, is an analog, and it can help balance your system. So even if you don't specifically have pain or anxiety, some people just find they feel better overall when they take some CBD. And with our stressful lives and different things that are going on, you don't really know if you're producing enough. And some of the they say ailments of modern life could be because your endocannabinoid system is not balanced. You're not producing enough of the natural ones, and so a lot of people can benefit from some supplementation.
So what I've learned also with the endocannabinoid system, many of us have endocannabinoid system deficiency because we haven't woken up those receptors in our bodies yet. And also what Ralph mentioned was also about balance. So what's a really important part is about the homeostasis, right?
So interestingly, some of the things that help you produce your own natural ones are the things that many people recommend. Meditation can help elevate that, but in stressful lives, when we're not balanced, that can contribute to some of the other, perceived ailments, whether it's sleeplessness, anxiety, tiredness. And so, the deficiency, some people don't even know that's just the way they feel. And by supplementing and finding a level, they may suddenly feel like, wow, I didn't know I had this deficiency. I just feel, more alert, more energetic, more relaxed. That's possible. If your system was imbalanced, you might have those side effects.
So, each of us is unique. So this is going to be different for all of you, and these are the kinds of things that Shaquan and Giovanni can help advise also once you decide on what products are right for you, because there are different, as they mentioned earlier, different delivery methods, different dosages, so those are important questions to ask for what you're trying to address, because there are so many benefits, so many conditions that it can address, and it's pretty much all over the store, as you can see, because inflammation and pain and sleep and anxiety and stress and depression and on and on and on. So mind, body, and spirit. So can you tell everyone just a little bit about the difference of CBD when it comes to, because very often you'll hear these terms, broad spectrum, full spectrum, and isolate.
Okay, so all CBD comes from the cannabis plant, and most of you might know that there are basically two strains. One is high in THC, which is the psychoactive, get you high, and the hemp plant, which is, was used for years to make rope and burlap and all these other things, is where it's predominantly CBD, but there are maybe 115 or so different cannabinoids that they haven't researched. So CBD is extracted from the plant, and I'm sure that the shop, they would agree that I always look for organic, first of all, because hemp is actually a plant that absorbs a lot of things out of the ground. It can work as like a detoxifier for the ground. So you really want to, and that's why this place is called CBD Organics, you want to only buy organic. And extraction methods also matter. You want to look for CO2 extracted, not solvents. You want as clean as possible. And so if you extract all of the elements of the plant, then that's a full spectrum. It has terpenes, which are aromatics. It has all of the cannabinoids. But some people, there is less than 0.3% THC in order to be a full CBD product. If you take a high dosage and you take it regularly, it's possible with certain drug testing, particularly mass spectrometry that can see parts per billion, you could potentially fail a drug test. So one of the main reasons that people would go for a broad spectrum is that the THC alone is removed from the overall mixture. Everything else is left. It's less common. I don't know, it may be harder to find. It may be a little bit more expensive. The pure, the isolate of just CBD may be effective for many people. It's isolated CBD. There's no chance of any showing up on a drug test. And it's generally cheaper, and that's probably a lot of what's in the corner drugstores, in the gummies. But full spectrum is considered the gold standard. So I generally recommend looking for organic and third-party independent testing. And there is, should I go into the entourage now?
And yes, and thank you, yes, because there is something known as the entourage effect, which is, go ahead.
So an entourage is something working in, together, a synergistic enhancement that the whole is more than the parts. So CBD alone can work, and it does work, and if you find relief from that, that's great. And it's a it's fine product. But what they did find fairly recently, initially the testing was done on the isolate because they really wanted to see how CBD alone worked. But then studies later showed that there was a much greater effect, positive effect, when the whole plant was used. So the interaction of the different terpenes and probably in a lot of cases that small amount of THC creates, a whole that's greater than the parts. So the effect is better, and that's considered what you really want to look for. Organic, full spectrum, independently tested.
Perfect, Rob. Thank you so much. We're going to do questions at the end too, okay? So perfect. Thank you.
You're welcome.
So I'm going to call up. Thank you so much. And again, listen, mind you, we want to keep your attention, and we want to just give you a taste of the cannabis plant and all of the goodness that we believe it has, being in this amazing store. But I will tell you that it's very scientific, so there's a lot of other components to talk about. I'm going to now bring up actually Shaquana's doctor, and a couple of other people in this room actually also are clients of Dr. Chris Stepien of Barefoot Rehabilitation Clinic. And I'm actually going to read a little bit. Thank you so much for being here. I have to tell you, when I learned about Dr. Chris, I was wowed, because he is a pain specialist, a chronic pain specialist. And I have to tell you, because even in his signature, it's fixing your pain, even when you've seen 3 to 5 other doctors, okay? So he is the founder and guiding force behind Barefoot Rehab, and he specializes in permanent pain relief, capital permanence, right? Capital letters. And he also has a great understanding regarding the proper function of the musculoskeletal system and injury prevention rehabilitation. And his ultimate goal is to help others live life pain-free, healthy, and flourishing in happiness. And if that's not the best way to approach life, I don't know what is. Right? So, tell everybody a little bit about yourself, because his business is around the corner, right? And it's what, almost 10 years old?
10 years old. Happy Valentine's Day, everybody. I love you.
Look at his hands. Look at his hands. Love. It's all about love.
Yeah, so we started 10 years ago. Can I tell a quick story?
Of course.
This might give some perspective. I was researching a little bit. Back 150 years ago, when mothers were giving childbirth, a lot of mothers were getting puerperal fever, which was causing a lot of mother death during childbirth. And this really smart scientist named Ignaz Semmelweis, I think I pronounced it correctly, he came in and said, I think we need to wash our hands. And then all of a sudden, all these mothers were surviving, and he became the savior of mothers. So nowadays, we have this chronic pain epidemic. Thank God for CBD, thank God for you guys. It's so necessary. 115 people die every single day from opioid overuse. It's out of control, it's not okay, patients deserve better. So from this place, when I was in chiropractic school, I was getting adjusted, I was getting massage, PT, stim, ultrasound, decompression. None of it was helping me. A 25-year-old kid with mild chronic pain, and I was like, what the fuck? I'm supposed to be a chiropractor and help people in chronic pain, and this isn't helping me. I was losing my shit because I had pain, I wasn't being helped, and I was like, how am I gonna make money and get paid to do this when it's not helping me? And then, thank goodness, finally I met this gentleman named Dr. William Brady out of Boston, and he taught me about the secret problem that almost no doctors are talking about. It's very easily removed by an expert, and it's adhesion. And when I learned about it, it fixed my pain for the most part. I'm 35 now, so it's still mild. Getting amazing results with patients. Those patients were telling other patients, grew very organically to the point now where we have the East Coast only body region specialist, Dr. Nina, New Jersey, and the East Coast only non-surgical arm specialist is in this room. They're all in Denville, New Jersey. So this all came from 10 years ago when we learned about adhesion. Sorry if I'm talking too much.
No, you're
and-
giving great, I mean, first of all, I think he is a visionary. I think he's innovative. I think this is something I have never heard about before, which is, I'm a lot older than he is. And I love learning about new treatments and alternative modalities to feel better, right? I mean, inside out, outside in. So your story matters, and obviously you're also helping so many people ultimately live not only a healthier life, but with more function and also with less pain, right? So tell everyone, you said you're an adhesion removal specialist, right? So what are the types of chronic pain, right? Like that many of your patients experience? Because you said something which the secret problem. What's the secret?
Yeah. How many of you have heard, besides my patients, how many of you have heard of adhesion before? 3 or 4. It's a secret problem. It's the most common cause of chronic pain. Nobody's talking about it. No medical doctors are talking about it. No PTs, no massage therapists, no chiropractors. We're the only clinic in New Jersey certified to find and fix it. So it's a secret problem. We have people coming from Massachusetts and Georgia and Virginia and Pennsylvania and New York and Oregon, all for this treatment. So it's a secret problem because it's not yet at the level of innovation where general healthcare has accepted this problem. So it's an amazing business opportunity for us because we have people coming from hundreds of miles away. But as we continue to get better results, I've noticed that other doctors and therapists are starting to reach out to us and say, what are you doing? This looks amazing. And it allows us to get better results for people. That's why it's a secret.
So before, because I do want him, if he's, I did ask him if he would do this, but, and do a little demo because he says he can unglue the meat suit. Unglue the meat suit. I am curious. I don't know how you could not be curious. But before we talk about a quick demo, okay?
I'll
can you-
volunteer if you need.
I was going to volunteer, but
I'm just saying.
I'm okay. So I will tell you, and thank you. What I'm also curious about, because you started off with talking about the CBD, tell us why you incorporated the CBD into your practice.
Yeah. So just because adhesions is an amazing thing doesn't mean it's a magic cure for anything. I don't have a magic wand. I'm just objectively looking at the reality of the situation. Adhesion helps a lot of people, most people in chronic pain. If somebody has severe degeneration in a joint, or they have a metabolic issue, extreme thyroid issues, extreme emotional issues, PTSD, I can't fix their PTSD with removing adhesion. So, but with people with severe degeneration, CBD is one of our go-to things to when you're in chronic pain and you don't have any adhesion to remove, then CBD will help you function so that your mind's just not like, I can't think of anything, how do I get there? So the beautiful thing about we're literally on the other side of the building. So today I was talking to a patient and I was like, my CBD Organics is over there. They have great quality stuff. I love Sharquana. Go say hi, give her a hug, and get your stuff. So it has a place. So knowing where specific healthcare options, the places for them, that's what about being a good doctor is. Just because somebody's in pain doesn't mean give them opioids. Just because somebody has depression doesn't mean go on antidepressants. What's the problem? What's the solution? And if you do that with all the different puzzle pieces in someone's chronic disease or pain, you have a really good chance of not only fixing a condition, but helping that person function in life.
Thank you, and I was listening to you, but I know why you incorporate CBD, because the thing is, it just elevates, okay, the opportunity of healing, right?
Of course.
Because it and also, well, I mean, when you say permanent, like, what does that mean for a patient?
Yeah, sure. So permanent doesn't mean that you're 100% better and the pain's never coming back. That's not realistic. What permanent means is that piece of adhesion that was causing 50% of your pain is now gone, but guess what? You're gonna go live your life with your degenerate joints. And what that means is that maintenance visits for some type of adhesion problem could be anywhere between every 2 weeks to every 6 months. So what that does mean is I am not the type of chiropractor who says you need to get adjusted once a week for the rest of your life and just go with that. The body has signs in the form of how flexible, how bad your range of motion is that tells us how much adhesion you have. And then an expert doctor can feel if there's adhesion there and saying, I can fix this, I can get you 30% better in a sustained way that lasts more than 2 days. Or you have zero adhesion, I'm done, go get some CBD.
And have many of your patients been able to avoid having surgery? Yes.
Thank you.
That wasn't even on my questions, right?
Hi Natalie, where are you? That's my friend Natalie. So my friend Natalie over here, she was scheduled for low back surgery, and for some reason she found us on Instagram or Facebook, and she's like, I want to see if I can avoid this. We diagnosed her severe disc degeneration, and thank God she had some adhesion. I said, we'll try. And then she canceled her surgery. You also have a little piece of paper. I apologize. It's going to be really hard for me to do a demo. So what I did instead, because I need an assistant. And
Like, we want to leave you wanting more.
yeah, but you have a little flyer with 6 of our patients. One of them's Natalie, and I think one of them's Allison in the back. But there are 6 patients with different issues. One was going to get his first rib removed at Johns Hopkins. Another was going to get labrum surgery on the shoulder. One spent $20,000 on 30 neck pain specialists until they found us. And so you can see their treatments amidst their stories and see if you have a degenerative issue or some other issue like fibromyalgia that could be helped by someone like us.
That is so awesome. First of all, I'm a lifelong learner, so I am so grateful that my journey has been from CBD to meeting Sharquana and Giovanni, and then it was really crazy. I'm going to share this quickly because I invited Sharquana to come to one of my women's networking meetings. And she comes with me, and Allison, who's in the room, was the speaker, and she shows, right, the chocolates that Dr. Chris has, okay? And Sharquana's sitting next to me, and I know Sharquana's a patient of Dr. Chris's. And then Allison says, she's a patient of Dr. Chris's. Well, then I'm talking to Teresa. Where are you, Teresa, our beautiful food sponsor? And Teresa, I'm talking to Teresa, and she's about to go into her doctor. And she says to me, I'm going into Dr. Chris. So come on, people. That is crazy. So, I know, see, Robert, so am I loud? Okay, because Robert thinks I'm too loud. You see, but he hears me at 10 decibels louder, everybody.
Just called, they wanted to know what that sound was.
No. Well, I'm seeing smiling faces. Okay? Including this fabulous doctor sitting next to me. So really, I have to tell you, when we're so grateful. I mean, Sharquana has been wanting for Dr. Chris to be part of an educational program. I think, first of all, he's offering something, right? Were you giving a special offer too?
Well, we're going to raffle off 2 chronic pain packages, consult, exam, 3 treatments. Normal value is $650 for 2 people who stay till the end. And then for anybody else who would like to try it out and is not convinced and is skeptical, which is completely normal when you've seen at least 5 other doctors or therapists, it's okay, I get it. We're going to offer 6 people who call the office tomorrow $149 for that same offer instead of the $650. So if anybody is curious, if you could have 30% less pain, 60% less pain, whatever, that's something that we can do to give. All body regions except low back and hip, because that's my body region, and I'm saturated. So we can still help you, I just can't discount you for that one.
Well, thank you so much for your participation, for your education, for learning more about pain, because there are just too many people that are experiencing pain. And I also think that I am sure with the cell phone today, there is a lot of neck and shoulder conditions. Tongue. Yeah, so you don't want it to get any more severe than it may already be to get some relief. So I would highly encourage you to explore more. He has a great Instagram. Your Instagram is?
Barefoot Rehab.
So I encourage you, by the way, I encourage you all to take selfies and tag, and please tag my CBD Organics and tag Barefoot Rehab and tag anyone that's in the room and Canna pop up, because that's the power of sharing. Thank you so much. You are awesome. Thank you so much. Okay, so if anyone's standing, does anyone want to sit that's in the back that came in? You're welcome, there's seats. Please feel free to sit, okay? And feel free to, you can, we have one more speaker before we do some giveaways and we answer questions. But feel free to eat and sample the teas. The teas are infused with CBD. They are my CBD Organics product. And also feel free if you want to get a massage during the talks. That's all cool. Okay, this is the time to just relax and enjoy yourself. Okay. So I'm going to ask Dr. Christina Hector of Onyx Direct Care to come on down. Thank you so much. So Dr. Christina Hector is with Onyx Direct Care, which is in West Orange. Thank you so much for being here. She is not only a family and sports medicine physician, but she's also incorporated medical marijuana into her practice. So, Doctor, why don't you tell everybody why, just you can tell a little bit about yourself, and then why you incorporated medical marijuana into your practice.
Hi, thank you for having me. I'm Dr. Christina Hector, as she said. So I am board certified family medicine physician and primary care sports medicine physician. So a lot of us know what family physician is, but I want to talk about a little bit of what primary care sports medicine physician. So I'm a physician that provides non-surgical management and treatment for sports and musculoskeletal related injuries. I treat athletes, I treat weekend warriors, anybody that has musculoskeletal pain. One of my youngest patients is a 6-year-old gymnast, and one of my oldest patients is an 85-year-old with osteoarthritis of the knee that did not want a knee replacement. So not too long ago, sports medicine injuries or musculoskeletal injuries were treated with painkillers and opioid medications. We realized that, as we've talked about, these medications have major side effects. They affect the organs, particularly the liver and kidney, to name a few, and they have addictive properties that have caused opioid overdose and also opioid death. So when I opened up Onyx Direct Care, I wanted to provide my patients with an alternative treatment that will improve their quality of life with as little side effects as possible. And one of that option is with the cannabis family.
Perfect. That was so perfect. So, you know what? Cannabis is medicine, right?
It is.
So tell us a little bit more about the health benefits of medical marijuana.
Yes, so as we talked about, cannabis is divided to two major groups, CBD and THC, which is also known as medical marijuana. And I use the term alternative loosely with cannabis, but cannabis has been around for centuries. And they have been known for, one, the anti-inflammatory properties, and also their analgesics, their pain properties. In addition to that, they're neuroprotective. They help with nausea, and they can also help with some psychological disorders, to name a few.
Thank you. So the other thing that Dr. Christina Hector can help guide you with is actually if you're interested in getting a medical marijuana card. New Jersey is approved for medical marijuana, but it's not easy to find a physician because there are not many physicians that are versed in the endocannabinoid system and or even prescribing for each patient's particular condition. So why don't you tell everyone a little, so Dr. Christina can talk to you more about that and guide you if that's something you're interested in exploring with the dispensaries that are in, which is a pharmacy for cannabis, what a dispensary is.
Yes.
So why don't you tell everyone a little bit about the qualifying conditions and kind of what the process is, an overview of the process.
Sure. Thank you. So medicinal marijuana, different from CBD, you will need to be certified, registered under the NJMMP, the New Jersey Medicinal Marijuana Program. Now you have to see a doctor to be certified to get your medicinal marijuana card, and I am one of those doctors. Okay, so when I see a patient for my first consultation, the first thing I ask is for you to bring your medical records of your formal diagnosis from your primary care doctor, your specialist, any imaging that has been done, and blood work. We will sit down, we will go over your medical records, we will do a complete history and a complete exam to see if you qualify for medicinal marijuana. Now, NJMMP has specific diagnosis that they approve for medicinal marijuana, and it is listed on the website. Some of these diagnoses, as we talked about, chronic pain, musculoskeletal pain, fibromyalgia, anxiety, post-traumatic stress disorder, some neurological disorders such as seizures and multiple sclerosis. So there's a few that that qualify for medicinal marijuana. So throughout our visit, if I feel that you qualify, I will register you and provide you with a registration number. You take that registration number and then you go and apply for your card. Actually, it takes about 1 to 2 weeks to receive the card. Once you have received the card, you will call one of the local dispensaries. The closest ones here, there's one in Montclair, there's one in Secaucus, there's one in Woodbridge. You call them and they will do their own consultation with you. They will sit down with you and they will, come up with a strand, pick a strand and the method of intake that is best for you. So throughout this process, you're not alone. You'll be educated throughout this process by the doctor, by the dispensaries who are very well educated in the strands and the form of intake. And I've actually been to dispensary just because I want to make sure that this is a place I want to send my patients to, and it's a very comfortable and knowledgeable atmosphere. So that's the process in general. Now, I generally follow up with my patient 1 month out, 2 months out, 3 months out, and every 3 to 6 months thereafter, because I like to keep close contact with my patients, because in my practice, we focus on treating the whole person and not just the illness. So medicinal marijuana, whether it's that, whether it's CBD, is part of a treatment for chronic pain. We have to consider the whole person in the treatment, and with that, we see more success in that patient's quality of life and decrease in their pain.
Are there any stories you could share that have been, something that, like, it gives great reward to be able to incorporate something like this into someone's healthcare regimen?
Yeah, I do have a story of one of my patients who has been to multiple doctors, who has been to orthopedic doctor, has had surgery on her neck, and she really didn't want any more back surgeries. And I was one of the alternative doctors that, I provide something different, and she was looking for something different. And in her treatment, we do a couple of things, and in terms of treating a whole person, we want to make sure that she's getting enough sleep, making sure that she's exercising. So she started yoga. I also, like Dr. Chris, I do manipulation. So I do manipulations of her whole back in the office. And I did sign her up for medicinal marijuana. And also, she uses a topical pain medication. Instead of taking pills by mouth, this is taking some of these medications and using it topically for a low back. So we treated her from many different angles. And she will come to me once a month and she said, I am sleeping better right now, and my pain is less, and I'm feeling better. And this is someone who has been seeing doctors for many years for chronic pain, and she's feeling like she's getting relief from, tackling it from many different angles.
Awesome. So I'm going to call up Ralph and Dr. Chris. Come up front, please. And if we have any questions, anybody have any questions for our faculty, our educators?
Hi, very informative evening. Thank you all for sharing your knowledge with us tonight. I'm a amateur endurance athlete, and someone I train with told me about CBD, like a year and a half ago. And the first thing he said was better sleep, which aided in recovery from training and competition. Since then, I've developed a herniated disc. So my question is, what could I expect from CBD, in particular with regard to my herniated disc pain?
So the one thing with CBD or cannabis is the actual disc herniation. It will not cure that, so you still have that herniation, so that it won't be able to do. But we have seen that, with this herniation, part of it is the surrounding muscles also. The muscles may be spasm, they may be tight, so that can cause pain around the actual disc, and sometimes you can get neurological pain. So CBD will help with one, inflammation of the muscles, the fascia, the tissue surrounded the disc herniation, and it will also help with the pain of that. So I think CBD will help in that aspect. And then we have to talk about other things that are associated with the disc herniation. You have weak muscles, you have weak core that we can work on to help support that herniated disc. So CBD will help inflammation, pain, but I think, in my practice, we also have to approach, everything and aspects of it and incorporate, maybe some strengthening of the back to aid with CBD.
And
Or
Dr.
medicinal
Chris?
marijuana.
I'm sorry.
And Dr. Chris has a special secret.
You were listening.
I don't have too much to offer as far as the CBD goes. It should help you feel better when you're having pain. I don't believe that it gives any sustained permanent relief or necessarily directly is involved in actually making that problem smaller. But if it helps you manage it or do the best you can given the activities that you're asking your body to do, then it's helpful.
Questions? Anybody? Okay. I'm going to work my way back. I'm going to come back to you. 1 second. Go ahead.
I was just wondering if some of the muscular issues you were talking about and neurological issues, if they could help somebody that, say, they have this esophageal spasm, something that might be a little bit more internal or not.
The problem I was talking about, adhesion, won't help that at all.
We may have to look more on the literature on that. The one thing with CBD, there's different forms of taking it. There's topical, there's the tincture, the by mouth. So it might be something to try one of the different forms, one by mouth, since it's internal. However, I will have to do more research to see if it will help with esophageal spasm, because a lot of the research is still out. And if you think about even with the medicinal marijuana, the list is still growing in terms of its benefits for certain diagnoses. So I wouldn't be surprised that it will grow even more and include some organ diseases involving or illness involving the organs.
Yeah. And
I would just say try it, because there's a lot of things, people have lower back pain. Some people don't get any relief from CBD, other people get complete relief. And so everyone's, body is unique, their endocannabinoid balance is unique. So it's really trial and error.